is Chanel Martin, and I'm doing a video validation for making an occupied bed bath. And so I've checked my physician's orders, and I've checked the patient's activity order, and this patient is ready to go. So I enter the room, make sure to identify the patient by checking the patient's ID bands, and I explain what we're going to be doing today. I make sure, of course, that I wash my hands prior to entering the room, of course,
Yeah.
So I put the bed to comfortable working height, and I also make sure to provide privacy by pulling the curtains back, and I make the patient comfortable by raising the bed a little bit, the head of the bed. So again, I wash my hands, I put on gloves. But before I put the gloves on, I want to go to the bathroom and make sure that I have warm water in the basin to be ready for the bed bath. And prior to even starting the bed bath, I want to make sure that I offer a bedpan or ask if the patient needs to go to the restroom. This patient is fine, so we're going to continue. So after washing my hands and putting on my gloves, I put on the cover sheet. And I remove the patient's blanket. Making sure to maintain privacy at all times. I will put the linen in the hamper. I'll also make sure to remove the patient's garment or gown. I'll put this in the hamper as well. So then I will put just regular warm water in the basin and make sure to fold the washcloth in thirds. And I will moisten the towel and clean the face, making sure to go from in to out on both sides, of course. Also being wary about any tubes. Cleaning behind the ears. And rinsing. Clean behind the ears. And rinsing. Clean underneath the chin. Clean the neck. Behind the neck. Rinse. Now I will be sure to add some soap to the water. And I will get my towel and pat the face dry. Dry behind the ears. And after putting the soap in the water, I will cover the patient's chest. Expose the arm. Then I'll make sure to wash from the wrist to the elbow, rinse, elbow to the shoulder, rinse also wash the armpits and rinse. I'll pat that dry. And the same will be done on the opposite side. And I'll expose the chest. Okay, so I'll get my soap and water. Cover the entire chest. An upward motion. Rinse. After rinsing, I'll make sure to document any redness or irritations. Pat that dry. To the abdomen. Making sure to be careful of any tubing. Also getting the creases and the folds. Making any notes of any abnormalities or irregularities. So rinse that area. And it's time to clean the leg. Get the soap and water, making sure the temperature is still right. Clean from the ankle to the calf and the knee. And rinse it. And from the knee to the hip. Making sure to rinse it dry. Then I'll pat dry. And for the foot, I will let it soak in the basin, making sure to get in between the toes. And I will remove the basin, also dry the toes. And I'll do the same on the other side. And then lastly, I will change the water and the soap and make sure it's warm enough. And I will soak the patient's hands, making sure to get in between the fingers and under the nail beds. And I will pat dry. And do the same on the other side. And now I will ask the patient to turn over, holding the side rail. So I will moisten the towel and clean the back in a circular motion, noting any moles or irregularities. And also clean underneath the folds. And we'll rinse in a circular motion as well. Apply any lotions to the back. Okay. I will also pat it dry with a towel, getting any moisture away. I'll moisten my towel and clean the sacral area, noting any changes or redness or inflammation. And I'll wipe in a front to back motion. I'll rinse, change the direction of the washcloth. And then as far as I want to pat dry, and I want to turn the patient over. Ms. Jones, is okay? Just lay back down. I want to make sure to clean her genital region in a front to back motion, and outward. I'll rinse. Okay. And I will cover her up, put on her gown. Maintain privacy for the patient. Cover the patient up, remove the cover blanket. Make sure to lower the bed to the lowest position. Make the patient comfortable. Make sure that the call belt is accessible to the patient. Take off my gloves, wash my hands, and document anything that I have found today on the INO chart and in my nursing notes. Thanks. Bye.